morning, Miss Wu. I'm your nurse, Nicole. Do you like to go by Mrs. Wu, or would you prefer me to call you Wendy?
You can call me Wendy.
Great, Wendy. How is your pain right now on a scale from 0 to 10?
It's out of 2, but I'm doing better right now.
Where is the pain located at?
It's in my back.
Does it radiate anywhere from your back?
The pain is kind of between my shoulder blades.
Okay, and how would you describe the pain? Is it dull, sharp, a feeling of fullness?
It's a feeling of fullness.
And how long has this pain been occurring?
Just recently, it just started.
Alright, well, you're due to have your pain medications. Would you like some Tylenol now to help with your pain?
No, fine, thank you.
Alright, just let me know if you would like some soon or if there's anything else I can do for you, okay?
Okay.
Excellent, Wendy. I'm going to do an assessment on you and then discuss over your diagnosis with you.
Okay, that's fine.
Alright, let me step forward.
It's a little sore right there.
This is about where your pain's radiating from between the shoulder blades.
Yeah.
Alright, I'll move back down and we'll take a listen to your heart.
Okay.
Check your capillary refill. Alright. Check your legs. Alright, I'm gonna go put this into the computer and I'll be right back.
Hello. How are you
Hi.
doing today?
Good.
Is this your nurse right here?
Yeah, it's my husband.
Hello.
Hi, nice to
Nicole.
meet you.
Nice to meet you too, sir.
Where's the trouble child at?
Oh, she should be on her way up sometime soon.
Okay.
You probably got lost somewhere knowing her.
Yeah. She's probably stealing something.
So are you feeling better today at all?
Yeah, I'm feeling better. Just have a little pain, a little soreness in my back.
Good, good. So I heard that she had surgery yesterday. Why was that?
Yes, that's correct. She underwent a procedure in the catheterization lab to balloon her coronary artery and place a stent in that same artery.
So what exactly does balloon mean?
It simply means that they made more room in her arteries for blood to flow through so it would not be blocked anymore.
So I guess I'm just confused. Why was it blocked and why did we need to make more room?
Well, there was a blockage from buildup of plaque that had formed in her main artery that caused for blood not to reach parts of her heart, which meant that cells no longer were receiving oxygen and that parts of her heart had died after a short period of time,
Sorry.
resulting in a myocardial infarction.
I got lost. I'm sorry.
Okay, well, we need to figure out what's going on first. So
What
what
did happen?
exactly is a myocardial infarction?
A myocardial infarction is also referred to as a heart attack, so your wife suffered from a heart attack.
You had a heart attack?
Is she gonna be okay?
We believe that she's going to be doing better now since the surgery. I just wanted to check some labs real quick, and then we can begin talking about where to go to next after this in the discharging process, okay?
Okay.
You had a heart attack?
Yes, I did.
Are you okay?
Yes, I'm
Just
better now.
let her relax. a little bit.
She's relaxed. She's laying down in bed.
Alright, well, it looks like your serum electrolyte levels are now normal, and that her troponin level is now down below 0.040.
What is troponin?
It's a marker in the blood that is indicative of heart tissue damage. Since it's lower now, the damage to your wife's heart muscle has ceased. In addition, the echocardiogram results are back, and your wife's ejection fraction is back up to a normal level as well.
Okay, good. So does that mean we can get out of here now and go home?
Seriously, I'm starving.
Well, I would like to get some discharge information for you, but before I can sign off on her discharge, I'd like to discuss some different treatment options that you can undergo to make sure that you heal properly and reduce your chance of having another heart attack. Is there anything that I can get for you in the meanwhile while I'm picking up that paperwork for you, Wendy?
No, thank you. I'm good.
Alright, perfect. I'll be right back.
You should really listen to her about taking meds this time, Mom. They really help.
You should just really be quiet and sit there and be calm, please.
She hasn't even said any meds yet. Just relax.
Relax.
Hopefully there's nothing too bad we have to do. Have you told her anything about like what we do?
No, not yet. We'll tell her when she gets back.
She's gonna get a real kick out of it.
Well, do you have your call? Oh, here's your call light. I'll get her out here real quick.
Okay.
Alright, hi Wendy. I'm back in here. Alright, so there's a few medications that the doctor has prescribed for you to take on a daily basis.
Here we go.
Do you have a preferred pharmacy?
Oh, we don't take any pharmaceutical medications. In all honesty, if my life depended on it, we would have not gone through the surgical procedure.
What do you mean that you would not have gone through the surgery?
My family and I were from China, and so honestly, we only believe in Eastern medical practices, so I usually refuse all Western medicine.
We're real granola about it.
Oh, so this
I'd
explains.
say holistic's the better word for it, but
So this explains your refusal to consume any pain medications since you've been here. Is that correct?
Yeah, from now on, I would only partake in some Eastern medicine.
Okay, well I can go look into some Eastern practices for you with the physician to help treat the effects of your heart attack and your chest pain. Okay?
Okay, that'd be great.
Alright,
Thank you.
Absolutely.
Seriously, listen to her.
You should really just sit there.
I'm having trouble with that, you know
have you told your mom what you did today?
that. No.
What did you do?
Just borrowed some money from some people
Borrowed
that
some money.
didn't want me to borrow it. Whatever. It's back now. Ground me forever. I don't care. It's over.
What did we tell you last time? You can't be borrowing money and not returning it.
I just want to go have fun with my friends. Lord
It's
knows
called
you guys don't
stealing.
give me
It's not
money.
even called borrowing.
You know, guys don't give me enough money.
It's a
anyway.
crime.
Whatever.
Okay, Wendy. I have done some research concerning the Eastern medicinal practices, and the physician has approved 3 methods to help you.
It's great. What are they?
So the 3 options are acupuncture, Chinese herbs, and
Meditation, maybe?
yes, thank you. From these, the Chinese herbs would be the most beneficial for you.
And how would the herbs help me?
The Chinese herbs, specifically cayenne pepper, is a natural vasodilator. This means that it will naturally dilate your blood vessels and facilitate the flow of blood to your heart and the rest of your body.
And when would I take these herbs?
For example, when you have severe chest pain, which is called angina, instead of taking nitroglycerin, which is a Western medical practice, you would consume the cayenne pepper. Does this make sense?
Yeah, so I would take the cayenne pepper instead of when I have severe chest pains instead of the nitro, like I usually do.
Yes, however, I'd like to talk to you more about the possibility of discussing some other Western techniques and practices and treatments if that's okay with you.
No, I really don't want
Mom,
to.
just listen to her. This is life or death.
Can you sit there, please, and be quiet? Well, I really would only prefer to have Eastern medicine, but I guess I would be willing to learn more about it, the Western medicine.
Alright, excellent. I just simply want to educate you more on other possibilities, and it's simply your choice on what you would like to do, okay?
Yeah, that's fine.
So, Western medication options would be the nitroglycerin for the chest pain, the atorvastatin to reduce your blood pressure, and to reduce your likelihood of having another heart attack, you could take the 5X. Now, one more thing to discuss to reduce your risk of having another heart attack. Wendy, how often do you feel stressed?
I feel stressed every day of my life.
And how does the stress make you feel?
It affects my everyday. I'm actually very stressed out right now. My daughter got caught stealing at school. I'm dealing with that.
Isn't the first time.
And it's not the first time, and it's a crime. And next time she does that, we're probably gonna have to bail her out of jail. which we don't have money because I'm the only one working because my husband lost his job.
This sounds like a very stressful time for you and constant stress in your life. This could easily affect your blood pressure, which could have played a large role in your heart attack.
Yeah, so what could I do to help with that? Oh, really? I never thought about that.
Unfortunately, yes, increased blood pressure can cause damage to arterial walls. In addition, when we are stressed, we tend to eat more comfort foods, which can also add to the buildup of plaque and blockages in the arteries.
Yeah, so what could I do with that?
Well, it's up to you. There are many things that can help reduce stress. Exercising regularly can be used to reduce stress as well as improving cardiovascular function.
Well, I really don't have that much time to exercise. I'm usually at work or doing all these family activities, so yeah, time's not on my side.
Well, it doesn't take up as much time as people normally think. Even taking the stairs instead of the elevator can be quite beneficial. The recommended amount of exercise is 150 minutes per week, which is only roughly 30 minutes per weekday without having any exercise during the weekends.
I mean, I guess I could start walking more. Is there anything else I could do?
I mean, I could start walking with you if you want me to. You need somebody to make sure you're doing it.
Well, this could be a great
That would
family
be nice.
bonding time. I also know you don't have a lot of time on your hands, but massages, meditation, and acupuncture, as we had mentioned earlier, have been shown to reduce stress. Even if these activities are only done once a week or every so often, they could be very beneficial and helpful to you.
Yeah, acupuncture and meditation are very common practices for people back in China. So I would actually like to start doing those.
Great, we have some informational pamphlets about exercise and other stress-reducing activities I can go get for you.
Yeah, that would be fantastic. Thank you.
I do know a spa in town with Chinese owners that would be great for acupuncture and meditation that we could go to and get a pass.
That'd be great.
Alrighty, here's those pamphlets for you.
Thank
And
you.
before you get discharged, I would like to review what we have discussed today.
Okay, so for Eastern medicine practices, I can use meditation, the acupuncture for stress relief, and then instead of taking my nitro, I would take cayenne pepper for my chest pain.
That's exactly right, Wendy. And how are you feeling about Western medicine practices now that we've discussed it a little bit further?
I mean, I'm still on the rocks about it, but I'm more open to learning more about the Western medicine practices to help me and help prevent the care of my health problems, the care of any of my health problems.
All right, excellent. I'll let the physician know that you're now ready to go home, okay?
Thank you so
Thank you.
much. We appreciate it.